Hi, I'm Karen Collins. I'm here today with Dan Buettner, founder and CEO of Blue Zones. Dan is the best-selling author whose pioneering work, aiming to find ways that we can all live longer, healthier lives, has had him trekking all over the world for National Geographic, exploring the blue zones that he and his team have identified. I'm thrilled that you'll have the chance to spend this time with Dan today.
The approach that I'm taking is we go into cities and workplaces, we look at the whole system, and we optimize the system. And we do so in a way that very closely approximates the way people live in blue zones. So we take the little pieces of blue zones and we put it to work in American populations, but largely by thinking about permanent or semi-permanent changes to the environment.
Mm-hmm. I think it's very inspiring to hear that that's possible, because some of the reaction, when I've talked to people who are health concerned, say, yeah, that would never fly in America, and then you proved it in the town in Minnesota where you worked, right?
Yeah, it did. We lowered their healthcare costs by 40%. But people say that this is impossible. They are smart people. It is really hard, and it took a lot of trial and error to get to where we are. Now we have a small army of people who are trained to take this idea and put it to work. And it's not something you can just give somebody a blueprint and they can go do. They'll almost always fail. It really requires a well-trained team who knows how to execute on a blueprint. Mm-hmm. It's like you can look out the window here and you can see that building there. It's got 4 or 5 different layers and there's 20 stories, and you could give an average person a blueprint and they won't have a clue on how to build it. Mm. It's kind of the same way with these. The good news is there is a blueprint and there are people who know how to do it, and it's putting that two together is the magic formula.
Well, and I think very interesting that you involved everybody in that community, from schools to design of public roadways to encourage walking, the development of social groups that support each other. It wasn't going in and fixing one thing. You really got involved throughout the community, right?
I call it a perfect storm.
Now, what would your advice be? Unfortunately, as one of the messages is, we really need to work together in our communities in whatever position someone's in. If their position is in the schools, if their position is in a company, wherever they are, to create an environment that helps people live more healthfully. But today many of us are in places where it's not supporting positive health. What advice would you give to someone today who's in that environment that doesn't support health? Move to Albertley, Minnesota.
Yeah, quite honestly. There are lots of healthy environments in America, and I'd move. I don't know, you're not going to change it by yourself.
Mm-hmm, mm-hmm. Or perhaps just really look around. There may be some others in your environment who also would like to live more healthfully, but if you have unhealthy habits, chances are the people you hang with have unhealthy habits. Yeah,
that makes a difference. But if you live in suburban Baltimore and there are no sidewalks and the closest place to eat is a McDonald's or an Arby's, and your closest place to recreate is a shopping mall, even if you have healthy friends, it's not going to be the whole solution. If you're living in an unhealthy place, unless you're an exceedingly gifted community organizer with several $1 million and a lot of time on your hands, you're probably not going to change it in a significant way to impact your own health. So, it's not the answer you want to hear, I know.
No, it's not.
But
that's what you have found. So,
part of it I spent a decade researching this. Part of it's a point of view, but also if you dig deep and look at what an example, if you get 100 people who you say get really healthy and you tell them all the things to get healthier, after 2 years maybe 2 of that 100 will actually be successful if they're really committed. So from Blue Zones, I can list a laundry list of things you can do that will help, but people don't do them long enough to make a difference. So you have to change the environment.
Okay, so you have it. We need to all get out there and change our environment.
All right.
Thanks very much, Dan.
Thank
I
you very
appreciate
much.
it.